Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
According to the Centers for Disease Control and Prevention, almost 1 out of every 3 people in the U.S. will develop shingles in their lifetime. And the risk goes up as you get older. In fact, if you can make it to 85, your risk of getting shingles is probably 50%. Shingles, as you may know, is that painful blistery rash that happens when the chickenpox virus is reactivated. It's like adult chickenpox, I guess you could say.
It's the worst.
You had it?
I have had it, yes.
Oh.
You know, that cancer stuff kind of messes with your system a little bit. When it comes to shingles, some common questions arise. Is shingles contagious? And maybe more importantly, how can I prevent shingles in the first place? Here to discuss this and other infectious disease topics is Mayo Clinic infectious disease specialist, Dr. Pritish Tosh. Welcome back to the program, Dr. Tosh.
Hey, thanks for having me.
Dr. Tosh, good to have you. So tell us about shingles, herpes zoster, and why it is that it's, for whatever reason, your body would, the chickenpox virus in your body would all of a sudden become reactivated.
Sure. When people get chickenpox, the infection doesn't actually go away. They get it, they get a fever, they get these rashes, but the virus sort of stays in the nerves for the rest of your life. Dormant. And your immune system, specifically called the cellular immune system, keeps it at bay. And over time, people's immune system just starts to wane. And especially with age, people's cellular immunity will wane. And so the older you get, your immunity to varicella zoster virus, the one that causes chickenpox, will start to decrease. And so this immune system that is keeping the virus in the nerves, keeping it at bay, at some point will fail. And then the virus sort of comes out from the nerve and then goes into the skin and causes these very painful blisters. More importantly, however, is there's a complication called post-herpetic neuralgia, which after the shingles blisters have gone away and the pain from the actual blisters have gone away, people can have that pain, long-lasting, debilitating, for years, potentially for the rest of their life.
It happens to 20% of people who have shingles. Isn't that about right?
It's about right, and it's a real problem. And that's really what we're trying to prevent. And so there have been now 2 vaccines, one a live vaccine and now a newer a killed vaccine, basically, that helps people boost their cellular immune response to varicella zoster virus so that their immune system is able to keep the virus at bay for much longer.
If the shingles shows up along a nerve path, which is what it usually does, is that the only thing that it does? It is always on some sort of nerve path, isn't it?
It usually is.
Okay.
The vast majority of circumstances, that is the case. We call it dermatomal, meaning that from the nerves that are innervating the skin, those nerves the virus in those nerves are reactivated. It goes down those paths and activates that.
Which is why you get it down one arm or on one side of your face, then not the other.
Usually.
So does the chickenpox virus, does that lay dormant in your nerves? Why does it show up in the nerve path when it doesn't do that when you've got chickenpox?
It does lay dormant in the nerve cell.
Huh.
Now, I said usually and most often it's single dermatomas, we call them. But occasionally, if people have really severe reductions in their immunity, people have had organ transplants or on chemotherapy, that virus, the reactivation can go all over. And we call it disseminated. And that can cause, disease all over, but it can also cause really bad things, including hepatitis, which is usually fatal, meningitis, pneumonia, all kinds of stuff. And so it is usually self-limited in terms of the rash, but especially in people who have bad immune systems, it can be really, really bad.
Is it contagious?
So when people have the eruption of the blisters, so we're talking about reactivation or shingles, the virus is there and it is contagious. So somebody who is not immune to chickenpox, if they were to be exposed to somebody with shingles, they wouldn't develop shingles. They would develop chickenpox.
Wow.
Wild. Now, you can get shingles even if you haven't had chickenpox, right? Or you didn't know you had it.
And that's the latter point is most important, is that early on, if people get chickenpox early in life, they may not present with the type of severe infection that will happen later on. And so several people may not even know that they had chickenpox. And so, even if you don't recall, or you ask your parents, did I ever have chickenpox? They say no. Many people actually have. And so the recommendation really right now is for everyone over age 50 to get the new vaccine, which is much better than the old one and really efficacious. We're looking at 90% range, even into advanced years.
Is that a one-time shot?
It is a 2-time shot.
Okay.
So you get it once and then between 2 and 6 months later.
And it's called Shingrix.
Yes.
All right. And it is available. It was in limited supply there for a while, but now pretty much widely available?
I think we're still running into manufacturing delays. Really, it's been such an amazing vaccine, and the demand for it has been high.
Is it better to wait for that or take the previous one that's not as good?
It depends on your risk profile.
Okay.
But honestly, I at this point I would wait and get this newer vaccine unless there is a strong consideration. Well, we really need to do this now.
Now, if you catch shingles early, is there a treatment? Is there an antiviral medication that might help?
There are. So there are antiviral medications that would be very effective in reducing the symptoms. And actually, these are the same antivirals that are used to treat herpes simplex, so cold sores or genital herpes, valacyclovir, acyclovir. These are all drugs that are available, and they are effective against many of the herpes viruses, including herpes simplex 1 and 2, but also varicella zoster virus, which is also a herpes virus.
But you have to catch it really early, right? I mean, it doesn't do any good if you've got the blisters and have been there for a week, right?
At a week, it's probably not going to be helpful. But if it is early on, I think the antivirus are going to be useful.
Chickenpox, incredibly itchy. That's the big problem there. For shingles, they are so painful. Can you just take a pain medication to get you through your shingles outbreak? I mean, it is crazy painful.
That's the hallmark is the pain, and sometimes your routine kinds of pain medications may not touch it because it's kind of a nerve pain.
Oh, man.
And so, we can give ibuprofen or acetaminophen, but sometimes we need to give some nerve pain kinds of medication to help people who have pain from shingles.
All right, we've been talking about shingles with infectious disease specialist Dr. Pritish Tosh. Remember, the new vaccination is called Shingrix. You need 2 doses, anywhere between 2 months and 6 months apart, right? Shingrix, everybody over the age of 50.
Right on.
All right, time for a short break.
When we come back, we'll tackle some other infectious disease hot topics this summer. Everything from Chikungunya to Zika. You're listening to Mayo Clinic Radio on the Mayo Clinic News Network.
Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
We're back with Dr. Pritish Tosh. We are back with Dr. Pritish Tosh, an infectious disease specialist at the Mayo Clinic. We have totally covered shingles. And now we're going to hit some other topics. And I want to start with Lyme disease, because everybody in Minnesota, and I think it's the northern part of the United States mainly, they're worried about Lyme disease.
As well, they should. This is one of a number of infections that can be transmitted by ticks. And often we will see the peak of Lyme disease, Ehrlichia, Babesia, these sorts of tick-borne diseases in late spring and early summer, especially when we have younger nymphal ticks floating around.
Nymphal? What did you say?
Small.
Oh,
the
small.
early life cycle ticks.
All right, and that's when they like to bite you.
They seem to be the ones that transmit Lyme more often than the grown-ups.
They're more hungry.
Yeah.
And Is Lyme disease more prevalent now than it used to be, or are we just better at catching it? Because there was a while there that people would have Lyme disease, go in to their doctor, the telltale bullseye rash wouldn't be there or whatever, and it would be 3 months later they'd finally figure out, oh, it is Lyme disease.
So there's the question about whether there's more of it is I mean, that's still up for debate.
Sure.
And some seasons we've just seen a lot more Lyme than others. And it is important that we make a distinction between some really confirmed Lyme diseases, including cutaneous Lymes with a bullseye rash. It can also infect your heart, so cardiac Lyme, where it affects actually the electrical system in there. It can get into your brain, neuroborreliosis, as we call it, get into your joints and these sort of things. And so certainly if people who have had untreated Lyme disease, it can have some severe complications.
So what are the symptoms? And if you do have these symptoms, you should go in and see your physician, because there is a blood test for Lyme disease, isn't there?
There is, and it's important to know when to use that test. So when people have that bullseye rash and they're feeling ill, so they've often it's fevers, muscle aches, joint pains, headaches are often accompanied by this, and they have this rash, the blood test that's looking at antibodies is often going to be negative. I mean, they have other things where you're looking at actually amplifying the bug itself, so by PCR, and those can be more useful in the acute setting. But often if you have that right constellation of symptoms, headaches, fevers, muscle and joint pains, and you've been outside, whether or not you remember a tick bite or not, and you have a bullseye rash, that's enough to treat. And in fact, I wouldn't test them because the test could come back as a false negative. Now, there's other people who have not been treated and they develop fevers and these other, say, headaches, or things with their heart or with their joints, including swelling. That's where we're looking at more advanced Lyme disease. Unfortunately, there's a lot of misinformation on the internet on things like chronic Lyme, where people will Google about really things about fatigue, some unexplained symptoms that are not consistent with what we have as Lyme disease, and unfortunately, they're getting diagnosed with what's called chronic Lyme, but that doesn't exist, if you will, medically, and doesn't get better with what is often prescribed as prolonged courses of intravenous antibiotics, which ends up being far more dangerous than what the people are actually going through.
And what is the treatment? And is it curative?
So when people have confirmed Lyme disease, there are several different antibiotics that are going to be helpful. And it is curative. So if people have cutaneous Lyme disease, we're looking at a 10 to 14 day course of a couple of different antibiotics. So you could use doxycycline, that's tried and true.
So it's bacterial disease.
It's a spirochete, similar to syphilis. Yeah, but it'd be basically a bacterial disease, and it's treatable with antibiotics. Now, if people have it in their brain or in their joint or in their heart, we may end up using different antibiotics for a more prolonged period of time, but we're looking at tops about 4 weeks.
And then you can still cure it even if it's in the brain or the heart?
Yes.
That's
All right.
pretty good.
Now, I have a recipe for chikungunya, but that's not what you're going to talk about. First of all, how do you pronounce it? Chikungunya?
Chikungunya.
Chikungunya.
Yeah, it sounds delicious.
What is it?
Yeah.
So how do you
cure
pronounce
that?
it?
So chikungunya is a vector-borne disease that you do not want to get. It's spread by certain kinds of mosquitoes, often in the tropics, although we are starting to see cases in southern parts of the United States, Florida, et cetera. And it can be just harsh. High fevers, bone pain, muscle
Like
pain.
dengue fever, right?
It's similar
Yeah.
symptoms to dengue, which you also don't want to get. And people can feel really, really bad. And some of the muscle and joint pains that follow can be for a while.
But chikungunya, see, no, I can't say it anymore.
You're doing fine.
Both that and dengue fever are in the United States now.
We have seen it, seen cases in very southern parts of the United States.
And it's the mosquitoes that are the trouble. Ticks and those mosquitoes.
Yeah. I mean, I'm not encouraging people to just dig a hole and create a bunker. Like, you do have to live your life. But there are things you can do to prevent getting bitten by these insects or other arthropods. If you're going to go out into the deep woods, certainly cover up, use insect repellent that contain 20 to 30% DEET. If it's really going to be out there, you can use permethrin-laden clothing, which is an insecticide, to prevent getting bitten or these ticks and mosquitoes from getting on you.
All right, food poisoning. It seems like every day or every week we're hearing about another case or cases of food poisoning, and it's the vegetables and it's the lettuce and it's different kinds of bugs. Yeah. So what's going on?
So there's a few distinctions, and when we talk about food poisoning, we should be talking about a toxin-mediated type of syndrome. For example, Staphylococcus aureus, staph infections, they can produce a toxin that can make people really sick. And classic is from potato salad that's been sitting out, people violently ill with vomiting and diarrhea. But then we're looking at bacterial multiplication. That's not really technically food poisoning, but we're talking about the same kind of thing, where if it's contaminated with a bacteria like Salmonella or E. coli, that can cause disease. We see this throughout the food supply, and things can get contaminated at any point, from where it's made to how it's collected to how it's processed to cross contamination within somebody's kitchen, and so the entire scope of something coming up from seed to the point where somebody is consuming it, there's a potential for contamination.
And so with that romaine lettuce, that issue in Arizona, if I would have washed it off more, that's not going to help in this case because it was in the lettuce itself, right?
Right. So it is being grown in contaminated water.
Yeah.
And so it is in the lettuce itself.
Oh, really?
Yeah.
I will edit in the shark sound effect right there.
You better put it in the microwave.
Hey, where are we at with Zika?
So I think a couple of years ago I came here saying the sky was falling. And interesting thing, so Zika is still out there. And what happened initially is it will happen with any outbreak, is if you have a population that is immunologically naive, meaning people who are not immune. And in this case with Zika, you have it spreading from mosquito to mosquito from people who are infected and have lots of virus in their body, which makes it easier for a mosquito to pick up the virus and then give it to somebody else. So you have a large number of people who are viremic and a large population who have not been infected. But in the winter months, you have fewer and fewer people who are going to actually be viremic. And so
viremic meaning carrying the virus.
Carrying the virus, where they're actually, the virus is in high levels in their blood. So over time, you have more and more people who are naturally become immune, just because they've been infected, and by that means there are fewer and fewer people who are viremic at any one time. And so for people coming from, let's say, traveling to a Central American country from the United States, they are now less likely to encounter a mosquito that has bitten somebody who is viremic. But that doesn't mean that's not going to happen, because you still have populations of people where people could still be viremic in those areas. So the virus is not gone, but the chances of it becoming endemic in a part of the world that doesn't already have the virus circulating becomes lower, just because those the pool of people who could potentially give it to a mosquito is much less.
So we've sort of dodged a bullet there.
I don't think we've dodged it.
Oh, okay.
So we have an entire population in the United States that are immunologically naive.
Yeah.
And we have people who are traveling to parts of South and Central America where this is still endemic. And so it is still, should be on our radar that you can have people come back and let's say introduce the virus into a immunologically naive population, and then it can spread like wildfire.
All right, we'll keep worrying about it then.
Hey, and you know when it comes to that foodborne illness thing, stick with hot dish.
Yeah.
Everything will be fine.
Not to worry. All right, we've been talking about shingles and other infectious diseases with a Mayo Clinic infectious disease specialist, Dr. Pritish Tosh. Dr. Tosh, thanks for being with us.
Thank you.